So thank you all for joining us this afternoon. It's potentially your lunchtime or your lunch break. And so thank you for making time to join us on this chat. We are going to be talking about how we might help healthcare with mapping technologies. And we've got a bunch of excellent speakers lined up for you to talk about different aspects of this technology. We've got Dr. Padmanesan from the World Health Organization, myself, who I will be talking about human-centered design. We've got Imran Kazi, who's the business manager of Lapis. And we will have a recorded presentation from Matthew, who's the co-founder of Mapwize, because they're presenting from France and won't be able to, they're not available in person. So they've sent us a recording that we will play. So these are all our speakers. Just going into the agenda, I would like to start by welcoming all of you and acknowledging the land on which I come from, which is the land of the Ngunnawal people, and which is based in Canberra. And I pay my respects to our elders past, present, and emerging. And I welcome all of you and any Aboriginal and Torres Strait Islander people as well to this presentation. We will go through this agenda quickly, as in different people will be talking about different things. And at the end, we will have a little space for questions and answers. But feel free during the presentations to pop your questions up on the chat, and we will all answer them at the end of the session. So without much ado, I will hand over now to Dr. Padmanesan, who will talk to you in a bit. So Dr. Padmanesan, over to you.
Okay, can you hear me?
Yes.
All right, cool. Thank you so much, Sneha. And I also acknowledge the traditional owners of the land and welcome any Aboriginal Torres Strait Islanders in the meeting. Good morning, or good afternoon, or good evening to everyone. My name is Padma. I'm one of the faculty at University of New South Wales. I also work closely with the World Health Organization in the Collaborating Center for eHealth. Today, I'm going to talk about a very important topic, which is the impact of COVID-19 on the health sector and what opportunities it has presented for digital health. Next slide, please. I want to, as an academic, we are very happy to showcase numbers. I just want to point to this slide, which is a busy slide, but you don't have to worry about looking in depth about it. This is one of the systematic reviews which has collated more than 81 studies which has been done all over the world during the pandemic, which is from the period of February to May 2020. They collected more than 6.9 million services, and they also compared this with a similar picture of 11 million health services in the comparative pre-pandemic period. These studies were conducted from multinational countries, including US, Italy, France, Germany, UK, Spain, Taiwan, Hong Kong, China, Qatar, Australia, and also from Belgium, Monaco, and Turkey. To simply say what the study is saying is that there's been a significant drop in healthcare service utilization during COVID-19. It is expected because we had lockdowns and people didn't use it. But if you look a little bit closely, you'll also see some of the services are actually gone up during the pandemic, which is mostly the GP level consultations or general services such as primary care. It's an important pointer to show that people have started segregating their healthcare services utilization based on their needs. So my first point is that healthcare service utilization has changed. I wouldn't say it's dropped, but it has changed. It's changed the way we are approaching health services. Next slide, please. One of the important things which has happened in the healthcare sector is that there's been a sudden thrust in people to shift from traditional modes of seeking healthcare to digital health. The funny thing is we've known, or we've been using telemedicine and telehealth for more than 2 decades. It is not new. It is not innovative. It has been with us for a long time. But only during COVID-19 pandemic, the utilization of telehealth services and telemedicine services has increased. There are several reasons, which we will talk a little bit later. But I just want to point direction to the audience about what digital health actually means. Digital health actually is like a portfolio of services which are offered through technology. Any services offered through technology is considered as digital health. For example, we have spatial services, which some of the speakers will talk in detail about. There are connected biometric sensors, there are wearables, there are mobile applications, there are text messaging, there are Google Docs, Google Doctors, like so you go and access services through internet, and of course the telemedicine and the personal electronic health record. So there are several ways which people approach, through which people seek healthcare services through technology. So an entire suite of things are called as digital health. So there is no single agreed definition for digital health yet in the world. So it depends on the service which you use. Next slide, please. So where are the areas where technology can be used? Actually, from where from cradle to grave. So literally from your birth to death, any point in healthcare services, you could use technology. So you could use for wellness and prevention. You could use for symptom prevention. I mean, you can use it for symptom diagnosis. You can use for monitoring, and of course, you can use it for treatment. So you use digital health tools in the entire gambit of a patient's journey or an individual's journey. And there's been a lot of thrust recently from pushing digital health space into wellness and prevention rather than just focusing on disease management. And I think some of the speakers in the following time will speak more into how prevention, digital applications and prevention will happen together. Next slide, please. This is another example to show that during the COVID-19 period, there's been an exponential increase in telemedicine visits. There's been the reports which show that more than 10 times increase in telemedicine visits in around the world. Next slide, please. And in terms of Australia, the Australian Institute of Health and Family Welfare, or the Australian Institute of Health Innovation, they have done a very good study, and they showed that during the COVID-19 pandemic time in 2020, there's been nearly 30 to 40% increase in telemedicine consultations, especially in the GP area. And you can see the highlighted bars in orange clearly spiking up, clearly showing the increase in the number of telemedicine and telehealth consultations in the GP clinics in Australia. Next slide, please. So to summarize, what has happened is that we have suddenly seen a spike in the use of digital applications and tools just by COVID-19 pandemic. It's because of the need more than anything else. But as I told you, these telemedicine and telehealth has been in our with us for last 20 years. But unfortunately, one of the disadvantages in health sector is that we have not innovated and adopted to the needs of the population. For example, health is one of the sectors which has lagged behind technology. If you take things, if you take sectors like aviation or space, they use technology at a phenomenal level. When you compare health, we are still using basic things like text messaging, and we have not yet ventured out into exploring tools like spatial technology in healthcare, and which is one of the reasons why we are talking about spatial technology in health today. And one of the other important pieces is that there has been a strong focus only on disease management, whereas we do not focus on other aspects of technology. For example, you don't talk about fall prevention that much, or we have not invested a lot of technology in fall prevention. We have not invested a lot of technology in mental health, and we have not invested a lot of technology in aspects of improving health in wellness and prevention. So there's been a strong impetus for us to move into that space. And finally, I want to conclude by saying that the world will now be divided into two phases: pre-COVID and post-COVID. And post-COVID, the future of care will mostly be virtual, and we all have to contribute to this development of digital health in this space. So with that, I would like to thank you, and I'm happy to take a few questions at the end. Thank you.
Thank you, Dr. Padmanesan. That was a very insightful presentation into how the world has changed post-COVID, and specifically in the healthcare system, and in the way people subscribe to healthcare, whether it's digital or physical, and so on. So that was very insightful. So thank you for that. That actually, like, one of the things that you actually said there, which is healthcare has not kept up with the needs of the population. For me, that is a great segue into what I'm going to be talking about, which is about human-centered design, and why human-centered design is very important, especially when you're designing or redesigning services or products for whatever system, or even specifically in the healthcare system. So I'm Sneha Prasad. I'm an executive designer at ThinkPlace, and my work focuses on human-centered design and designing for user needs, whether it is policies or whether it is strategies or products or user experiences, or including wayfinding experiences. So that's about me, a little bit about me. Next slide. Just around what Dr. Padmanesan said and how things have changed in the healthcare sector post-COVID, I would like to understand from all of you what are the biggest challenges you've experienced or noticed in the healthcare system. So Dr. Padmanesan definitely mentioned one or two, but from your personal experience, I would like to understand what that is. And if you could post that in the chat, that would be fantastic. So like a quick sentence. So I'm just going to give a moment or two for you to all put that in. In the meanwhile, so just taking a look at this picture, whether it's in healthcare or across the world, there are some really good examples of how products are designed or services are designed, which are not really in tune with human needs. Yeah, thank you, Yellow team, for your answers. Communication gaps is definitely a big challenge you've been facing in this post-COVID world. And could you explicitly say whether those are communication gaps between healthcare providers or between patients and providers? That would be fantastic. Yeah, so back to this slide. What I was saying was human-centered design is what is important in bridging that gap between how services are usually designed or how products are usually designed in such a way that people can actually use those services. And there are a lot of examples around the world, and this picture is just one of them, where you've got a bridge that actually helps people cross, but it doesn't really consider what human behaviors are. And the reality of human behavior is that they will continue to do what they have to do, and we have to keep up with their needs, or change or design products or services according to their needs. Next slide, please. So human-centered design is just a way of understanding people's experiences and bringing those experiences into the design process. It's actually a search for unstated needs. It's not about asking people what they want or giving people what they need. It's about trying to find those really unstated needs, and you bringing, designing services or products around that. It's about developing possible solutions based on insight. Human-centered design is not giving people or expecting people to provide the solution. It's not about just consulting and ticking off the box. It's actually a very involved process, and it involves a lot of empathy. Just on the next slide. Thanks, Amelia. If you looked at experiences across the healthcare system, the way human-centered design actually works is about mapping all the roles in the system. We typically look at all the people who are involved in the system. So whether it's patients, carers, the doctors who provide the services, or nurses in the system, or even the staff, hospital staff, the back-end staff that are involved in the logistics and the facilities and things like that. So you look at how all of them interact in the system. You look at their journeys and pathways and interactions, and I'll just spend a moment trying to explain what this is. So journeys are like your typical journeys, like Dr. Padmanesan referred to it as a patient's journey from birth to grave. That's a journey, and they will interact with the hospital system at different points in their life journey. And where they interact with the hospital system is what we call as pathways. And there are interactions within that pathway, which is where they interact with a doctor or with the nurse, or with it could be even a system, like a technology system that they're interacting with. And that's where they're getting their services from. So when you look at human-centered design, you're actually looking at mapping this entire system out. You're looking at how people navigate through this, and you're also looking at those interaction points at where services are actually provided, and you also look at the actual human the range of emotions that are involved in a space like this. So typically hospital people coming into the hospitals and interacting with the healthcare system, it's usually a time of stress for them. It's a time of anxiety for them and their families. So you're also looking at all of those components when you're designing the system, and you look at which are those really critical interactions that you want to see and kind of alleviate those problems, the problems that are there in those interactions, either through the use of technology or better service or something like that. So that's the crux of how we incorporate human-centered design into into designing of new systems or products. Next slide, please. This is another example of how a map could be typically drawn. So a patient between care, this crisis or admission into care, treatment or diagnosis, we're looking at how their typical experiences are. This is just one of the examples from a project that we've done in the past. Next slide, please. There is a case study, a famous case study most of you may know already about this really famous case study from GE Healthcare. Doug Dietz, who is an industrial designer working with GE Healthcare for a long time, he came across how, I think in one of his visits, so they're the people who designed these large MRI, CT scanning machines. And he noticed how children particularly would get very anxious, and the fear in their eyes when they were getting into a room like this or to have to undergo a scan. And they went through this process of human-centered design to realize, to see how they might alleviate that problem. And what that actually was doing was, when children are scared and they were going into these machines, they wouldn't stay still during those critical points. You need to stay still in those machines, and they're not really friendly with all the noise and the humming and the lights flickering. And that would actually cause them to have to rescan again because the scans wouldn't come out properly. So that actually caused a delay in the healthcare process itself. And so they looked at going through this human-centered design approach. And I'll cut the long story short, but the idea was, at the end of it, they came up with these, wonderful experiences that children could actually have in these spaces, and that actually cut down the need for having to go through a second scan. Patient experience improved by 90%, and so on. So there are some really fantastic case studies out there, even in the healthcare space, for how human-centered design or integrated with technologies even made things better for people. Next slide, please. Yeah, at this point, we want to hear from you. We're just going to put up a quick poll on the chat on this webinar, and then we would like you to respond. So Thomas, who's working in the background, if you could bring up your poll, please. Thank you. We'll just give you a couple of seconds to respond to this. How do you think your healthcare colleagues' experiences have changed working and navigating within hospitals post-COVID? Just give you all a few minutes, minute more to respond. Starting to get some responses in. Has it improved for the better? Has it changed negatively? Yeah. Excellent. We're going to end the poll, and we'll share the results on the poll. So we've got just a few responses, and that's fine. So some of you say yes, considerably, with a positive impact. That's really fantastic to hear. And some of you are not sure, and I guess that's because you're probably not across that side of things, and that's fine. We've got another question. We'll bring up the second question. Poll number 2. Yeah. How do you think patient or carer experience has changed in navigating around hospitals post-COVID? So what is patient experience like when it comes to healthcare, from your own experiences or from what you've heard? Yep. Just waiting for a few more responses to come in. Just get a few more attendees to participate in this poll. Excellent. Yeah, we'll just end the poll there and present that. So it looks like most of you think that there is no change for patients or carer experience, or potentially a considerable change in the way they navigate hospitals or healthcare with a negative impact. And that is kind of reflective of what we've heard from Dr. Padmanesan from his talk, as well as from what we see around. If there is or isn't, and I think we can stop sharing the poll results. Thank you very much. With that, it's like there is that big flux. There's a lot of change in how people are utilizing digital services. There is there seems to be a flux that's happening at this point, the way in which services are transitioning and how healthcare might have to change. And as human-centered designers, you'd want to understand why that change is happening, or how those things, how technology might help or assist with some of these things. And on that note, I will just end my presentation there and hand over to Imran, who is going to present to you the crux of this webinar, the main information. Yeah. Thank you, Imran. Over to you.
Thanks, Neha. So welcome everyone to the webinar. My name is Imran Kazi, and I'm business manager at Lapis. We go to the next slide, please. So just a bit about Lapis before we start the main presentation for the indoor map solution. Lapis is a Melbourne-based software development company. We have been developing the mobile and web application for almost 20 years. We work with many government and non-government organizations and provide solutions that not only actually solve a particular business issue, but also actually integrate with the wider enterprise systems. So next slide, please. As I said, we develop and particular expertise in apps, both mobile and web apps, and specializing in particular with location awareness capabilities. So we utilize mobile maps and geolocation of the mobile phones and create specific user experiences that give them contextual information based on their location, both indoors and outdoors. So not only help them finding the location and finding wayfinding, but also actually if they have if there is a requirement to have specific information on a particular place, then we actually provide that information within the app as well. Apart from building mobile apps, we also integrate those apps to the wider enterprise systems, such as asset management, scheduling systems, and backend financial systems. We are Australian partners with Mapwize. Mapwize is a French-based tech company that specializes in indoor maps. We are also strategic partners with ThinkPlace. And together, we can bring a unique solution to the healthcare industry in patient care for in and around hospitals using human-centered design, as Neha was mentioning, geolocation and indoor maps. Next slide, please. So the next presentation is from Matthew Gerard. He's the CEO and founder of Mapwize, and he'll cover the Mapwize indoor solution, its capabilities, including a demo of an implementation they have done in the hospital in France. So that can kind of give you a gist of what the solution can do for patients in and around hospitals.
I'm Mathieu. I'm co-founder and CTO at Mapwize. I'm really happy to be speaking with you today and telling you more about the indoor mapping solution that we're developing. So Mapwize is an indoor mapping platform. We are really building software to help bring the digital revolution in buildings. We think there are a lot more services that will be coming in buildings in the coming years. And we have decided to take the side of the map to really help anyone to digitize their space, their campuses, and being able to use those digital maps into web and mobile applications. And we are deploying a lot of different verticals, from university campuses to office buildings, to cruise ships, or whatever other kind of buildings you have. But of course, hospitals and healthcare is something really important, because we believe that there are a lot of direct use cases and value that we can bring to patients, to visitors, and to medical staff. So we aim at bringing interactive maps, wayfinding, search engine, a way to visualize the map of your buildings with all of the different assets and everything that there is on it, being able to search for any place and then compute the best path to go from where you are to your destination. So let's have a look at how it looks in practice on one hospital. So basically, when you look at Mapwize, we start with an outdoor map. But as you zoom in, you're going to start entering inside of the building and see all the details about that specific venue that you are in. You can see all the different points of interest. You can click on them. You can get details about those. You can see all the different floors, going from first floor, second floor, third floor, and then seeing again all the different services that are inside of that hospital. For example, you can look for the maternity. I'm sorry, this venue is in French, but I'm not really able to demo all the hospitals that we have, as they are private most of the time. But so you can look for the maternity there on the first floor. And if you'd like to go there, for example, from the main entrance, then we're going to compute the optimal path and then tell you to go to the elevator, go up to the first floor, and finally to your final destination, giving you time, distances, and all the information you will need to go along the path in the different buildings that you would need to go through. So that's the main features of the map. Now, of course, those maps are meant to be used on all kind of different screens and all kind of different devices. So you can bring those maps on the desktop, on the mobile apps, on tablets, on kiosk, on any application that you would want to include your map into. Also, we really want to make those maps inclusive and bring different ways of going around the building. So especially if you have people with disabilities, if you would like to restrict the use of some stairs or the areas where there are steps to prevent people in a wheelchair, for example, to go through those, that's something that you can do in Mapwize. But you could take as well the direction mode one step further and use that to specify different routes that the staff can take because they have badges or keys versus the routes that the normal patients and visitors can take inside of your building. And also, we have the possibility of having customizable views, customizable maps, and also maps that are meant for different kind of use cases, and potentially maps that also vary in time. And so there we see that there are multiple options such as staff, maintenance, security. But we also had some of our customers that took advantage of this feature to make very specific maps during the COVID time that we went through and we're still going through. But that really took the chance to customize those maps and to see how the hospital has been evolving along the evolution of the COVID and the number of patients that were in that hospital. And so basically being able to specify using color codes where was the areas where the COVID patients were actually treated that had very specific medical measures in place, and the other areas that were for the, let's say, normal operation of the hospital or the non-COVID cases. So if we look a little bit at how that could look from this demo, so now we are looking at the normal view, but here we have actually the deconfinement. So at the moment there is not that much of the hospital that is reserved to COVID, but basically we can see what other services in the different parts of the intensive care, the maternity, or the some of the medical services that are dedicated to the specific sickness. At some point, we could also compute special itineraries if the staff had to carry some COVID patients from one service to another, for example, from the emergency to the intensive care or from the intensive care to the radiology, then they could actually use Mapwize to specify that they would want to have a COVID safe route for those patients. Now, there are some buildings that take that even further. And so in this one, you see that we basically have different views. As you zoom in, you will be able to enter also in the building. And there are some universes, or some views that are more dedicated to maintenance, where you will focus on distinguishers in technical areas, for example. Some that could be for emergency, where we need to evacuate the building and provide very clear descriptions to the users and to the first responders. Or so some IoT view, where you would have sensors and live data that would be directly displayed on your building, like live occupancy, for example. Now, if we come back to the main view, there we see that we can actually have multiple options to see details about the maps. And like if you have meeting rooms, you can really have a lot of details about those, like pictures, like websites, like the actual availability of the room along the day. So those are all things that you can also add inside of the Mapwize platform. And the goal of those maps is really to integrate into any kind of application, an application that are developed specifically for your needs and for the users that you have. And so we can integrate as well with indoor positioning systems, with facility management solution, or other healthcare specific solutions and systems. One of the very interesting thing as well in healthcare is asset tracking. So if you connect Mapwize to your preferred tracking hardware, then you can use the maps to see in real time where the assets are, find those resources, and then help your staff get to those resources in the best possible way. We can also use those maps for data visualization. So being able to take any kind of data set that you would have and then use that to color specific rooms. And so we have had multiple usage around occupancy rate, air quality, temperature, maintenance operations, and anything that you would want. Basically, any kind of data sets that would make sense for you. Those could be projected on the map, so you can really have a nice way of visualizing that from a geographic perspective. And we recently released our Tableau integration. So if you're using Tableau software, for example, you can see that we have the maps that's colored specifically like a data set. And so if you say, I'd like to see one specific store, or if you want to go through your data, either from the graph perspective or from the graph or from the map, you can basically use that as a way to interact with your data sets. Also potentially filtering to see specific areas directly on your map. So that's integrated into Tableau, but obviously those can be done inside your own apps or your own dashboards. So one of the hospitals that I showed you is one in Belgium. So we have multiple ones. This one was one of the first to use Mapwize, and there we've deployed very quickly the solution along with QR codes. So across the corridors of the building, there are QR codes. If you scan them, you will be immediately located to your current location, and so you can use that to compute your itinerary to your final destinations. We also have some that are a lot larger, and so for example, this one where the building is so big that they had colors to really show the patient and the visitors where they are, because it's so easy to get lost. That those colors have been also used and replicated on the map, so that it's really easy to link the location where you are in the building with the location that you have on the map. So we've already had some very quick demo, but obviously you can find all of those on our website, and you will find them in some of the material that we can provide you after this webinar. We have 120 customers worldwide. We have a lot of healthcare, and so we are really happy to partner with Lapis and being able to bring all those maps directly into your venues in your regions. Thank you very much. And if you have any questions, don't hesitate.
Thank you very much, Imran. And Thanks to Mapwize for that presentation. We're going to open up for
Mathieu,
questions.
I'm co-founder and CTO.
Yep, we're on questions. We're opening up to questions. We've got one question that's come in. We've got another couple of questions that are coming in. I encourage you at this point, if you have any questions around the technologies that have been showcased or anything that we've discussed, please put forward to the panel, and Dr. Padmanesan, myself, or Imran will try to answer. The first question is from Zafar to Dr. Padmanesan. How can private industry contribute to bring healthcare adaptation of technology services?
Thank you, Zafar. It's a very good question. I think one of the major drawbacks is that healthcare industry has not attracted enough attention from private sector. And I often quote the examples of space technology and aviation. It's only through this private sector partnership there's been innovation. Without innovation, there is no opportunity for us to evolve for better healthcare. And innovation is mostly driven from private sector. So we have enough existing tools are enough to do the regular healthcare services. For example, connecting patients to a pharmacy, delivering pharmaceutical goods, connecting patients to doctors in remote areas, like through telemedicine or virtual. All of that, those things are there. But beyond that, we need strong partnership from private sector to do innovative things. For example, all the case studies which you guys have highlighted, from Sneha to Imran to the Mapwize, they're all excellent tools. All of these innovative tools can be incorporated into healthcare. And I think private sector participation is very crucial, even though it's considered as a service sector. Without private sector partnership, in my belief, there will not be innovation, and without innovation, there will not be growth. So therefore, to answer your question, yes, private sector participation is very critical for healthcare. Thank you.
Thank you, Doctor. We've got another question from Paula. What kind of infrastructure is required within the building to enable use of Mapwize solutions? Is it costly to set up the infrastructure? And I might throw this to Imran.
Yeah, no. So, the basic map can be established without any infrastructure needs very, very quickly. I think the fundamental requirement to set up the indoor maps is the building designs and the building, whether they're CAD files or PNGs or TIFF files. So that's the initial requirement. After that, it depends upon really what complete solution and experience you want to provide. So if you want to provide indoor positioning, which is the live dot on the map, as you would have experienced outdoors with Google Maps, where it gives you a live position. So one is the way finding for going from point A to point B. The other is actually how do you monitor the live movement of the patient. That will require mostly the Wi-Fi connection or the use of eye beacons based on the accuracy needs. So that is the next level where you probably will require something. But because most of the hospitals would have Wi-Fi connections, that can be done easily. But if you want to increase accuracy, then there are other things that can be provided. I hope that answers your question. So initial requirement is not much, and there's not huge amount of any infrastructure that's required.
Thank you, Imran. There's another question that around statistics. So do you have any statistics on what the impact of digital wayfinding has on hospital staff? For example, quantifiable reduction in staff hours, or for customers, patient responses to digital wayfinding. So do we have any statistics?
So there are case studies which require which talk about generally increasing the patient satisfaction with digital wayfinding. So instead of actually them going through and following some of the traditional modes of wayfinding within the hospital with signage and lines. But there are general studies. The specific numbers from hospitals can be provided, but I think that's something that we will need to check with the actual hospitals, and that's something that we can follow up. And if they're happy, then we can actually provide those numbers. But there are a lot of case studies that talk about providing this kind of capability does increase the efficiency and reduce the kind of the questions that the general staff need to get interrupted and asked by the people in the hospital. So that definitely gets reduced and the satisfaction increases. Specific numbers, we need to go back to the hospital.
Thanks, Imran. There's a question from Chris Rose about Matthew having mentioned, I think during his video, that a lot of hospital maps were locked. Does that mean that maps are shared for staff rather than for customers? How would you onboard for full effectiveness without unlocking maps?
Yeah. This is just based on the hospital and their policies. So, for example, some hospitals might have actually done it and then done it initially for their staff and their maintenance staff, because you can see that it's not only patient, but there is a maintenance view, and there is a security view, and there is a kind of a emergency exits or emergency entry views for ambulances and stuff like that. So that might be it, but there is no reason why a view cannot be made, as Matthew shown in one of the hospitals in Denmark, I believe, was that there were few views, and actually he was showing, and probably with permission from the hospital, to share those views, because not all the views will be open to the patients. Patients will have probably the default view, but what he showed in terms of the emergency exits and the security view and the maintenance view would be locked down and will only be provided to the people who will require them. And as well as the integrations, you can decide which integration is applied. So for example, the live data of the people for security reasons will be locked out. The booking systems and the hospital rooms, and when they are available, will be locked down from external view. So that he probably is more referring to those things, but the general view of the hospitals would be open to everyone. And I agree that the full effectiveness will not be achieved without actually having that view available for the general population and the patients.
Thank you, Imran. There's one more question around, do hospitals typically manage their own maps, or is it a service that they outsource to Mapwize or another consulting group?
So, so the way it works is that we are the local partners of Mapwize, and we work with ThinkPlace, and we'll actually design the initial implementation and the solution, and after that can be handed over to the hospital if they have resources and staff. Once actually you have set up the initial maps, then the only reason you would go and change the maps is either you have actually created another facility within the hospital, for example, introduced a new ward or changed the wards, or you have a specifically maintenance works going on and you don't want one of the areas accessible to the general public. All of that can be done easily with a backend web interface, and that can be given to a resource in the hospital, whether they sit in the building maintenance of the hospital or administration, or if it is required, then we can easily provide that service as a service as well. But I think most of the time hospitals probably will have their own staff to do it. Now the other thing is that we also work with Mapwize to do any kind of integrations with the third-party system. So if you want, for example, have some IoT system where you have tagged all of your wheelchairs, and you would now want to see where those wheelchairs are at in a live view on the map, so that you can send someone to collect them easily. That's something that we can do as well, and integrate with the patient booking systems. We can send SMS or in-app messages to your patients when their booking is due, with a link to the map of where exactly they would need to go to have their appointment. And if the room changes, then that update can also be sent. So there's a lot of things that you can do for patient care to reduce their kind of kind of experience interacting with the hospital and deal with any changes.
Thanks, Imran. There's a follow-up question on that. Have you integrated with patient room assignments for allowing visitors to locate loved ones' rooms? And I just like that question a lot because I think these are the kind of things we uncover during research. So yeah.
Look, based on your hospital scheduling system or visitor information system, it has a open what do you call interface that we can utilize. We can easily do that. So for example, we can attach it to your hospital opening hours, and if if a patient is there and they would like someone to visit them, they can actually allow that to happen, and a message will be sent with the visiting hours and say, okay, this is the place and link where your patient is at, and it will give them the location from the hospital entrance to exactly where the patient is located. I mean, of course, there are certain things that needs to be taken care of, and that can be done in the design of the patient data because it's very sensitive, and who has access, and you make sure that it's secure. So all of that needs to be considered, but that's not something that is not possible. It's very much possible.
Thank you, Imran, for answering all those questions. There's just one last question that that's probably a good way to also wrap up. But before that, there's just one more question from Tapalina Bhattacharjee. Can this solution provide a direction to the hospital, outdoor navigation, along with the inside hospital, which room to visit for the appointment?
Yes. So the short answer is yes, and that's where the integration comes in. So we'll have the hospital mapped out that can be integrated to a service called, for example, Google Maps or Apple Maps and stuff like that. So we can use it as a service and definitely can provide an end-to-end kind of including, actually in some cases you can actually include and consume the public transport data as well. So this, all of that is quite possible.
Excellent. The question is one from, how do we deal with privacy concerns in the health sector? This is a major concern with policy, and I will open it to both of you, both your views.
So, you know, we deal with the privacy as with any other sensitive data is secured. So there are different technology implementation that you can do, including registration, two-factor authentication, giving people access to only information that they need to have based on their roles. And stuff like that. So it's like, you know, your banking application or your MyGov application, where a lot of data is stored related to your personal you know, taxation or health. You know, commonly it's two-factor authentication, commonly it's role-based, commonly it's only data, minimum data available for a particular role. So all of that kind of applications, and then, you know, doing an exercise with the actual hospital or people who want this solution to do a threat modeling and applying different techniques to make sure that only the data that is required by a particular role is available for that role. And there are other things like, for example, secure communication, doing saving data in encrypted mode and stuff like that, and make sure that no data is actually is saved on the application itself. It's all communicated and it's encrypted.
Thanks, Imran. I hope that answers and covers off any concerns. Just opening it to Dr. Padmanesan to see if you had any views on privacy or policy in this space, especially to do with digital.
Sure. I think it is a question where I don't think we'll ever find an answer. I'll be very honest with everyone. it's going to be the pricking point for technology developers and digital health enthusiasts. I think we will not hit the comfort zone of having 100% private, 100% privacy plus very good technologies. I think we will have to come into some kind of a balance to achieve that. Having said that, I think there's been a lot of new tools and new kits which are available to restrict the access to private information to others. For example, the My Health record in Australia is a good example. There have been more than 2-3 million enrollees so far, and it's growing steadily. And if you look at it closely, the government has restricted access of this My Health records to private companies, insurance companies. So they are making a lot of they are adding layers of security to access them. But I don't think we will never hit that sweet spot, because if you look at Fitbits or if you have any wearables, your data is already out there. People are tracking you, and I think what we have to really do is to see how much value you are getting out of something by foregoing some of your personal data. I think if let's say I'm an insulin dependent person, if by putting my blood sugar data live and then getting feedback in an instant feedback will save my life. And I think that's I would definitely put my data out in the open source or in the web or in a wearable. I think that's the kind of balance. And I don't think we have kind of maneuvered the individual level privacy. We are assuming privacy as a one blanket rule. Maybe it shouldn't be the same. It should be an individual based. Privacy for me might be different for an elderly with dementia. Definitely they need more help. So technology could help them. So I think we should not, we should have a broader approach and not have a one blanket will fit everyone. So we'll have to broaden our thinking in privacy. But in my opinion, I don't think we'll hit the sweet spot. We have to come to some kind of compromise.
Thank you very much, Doctor. Imran, just a last question for you. Are there manuals that explain everything about these solutions? And maybe that with the answering that, we can wrap this webinar up.
Yeah, we can. We have the manuals or follow-up presentation that we can share, definitely.
So we will be sending out to all the people who attended a link to this recorded webinar, as well as a manual or some slides that explain a bit more about these solutions. There are a couple of more questions that we will try and answer through that email. So yes, your questions will be answered. That's it. Thank you everyone for attending and for participating and for listening to what we had to say. And we're really keen on taking this conversation forward. So if you would like to talk to us, contact us at info@lapisit.com or contact us through the email that you will get from this event, follow-up of this event. Thank you everyone for your time. And that's a wrap.
Thank you.
Thank you. Thanks everyone. Bye.